Hello everyone, I am Dr. Santosh Kumar, founding director of Momentum Orthocare. Now, when coming to the commonly asked, commonly thought questions that you may be having regarding joint replacement, let's start with knee replacement first. Knee arthritis is a major issue which limits our mobility, movement. It affects our movement, our social life, our professional life, personal life, and it affects the confidence of a person who is incapacitated because of knee arthritis. To start with, in earlier stages, we promote heavy muscle building exercises to treat knee arthritis, because knee arthritis is an issue of wear and tear. Along with this, muscle weakness is a predominant reason for progression of knee arthritis. So, we treat with heavy muscle building exercises like half squats. Even squatting is good, full squats, not after knee replacement, but for treatment of knee arthritis, a person can squat to build up muscles. And once the knee arthritis reaches the stage to which it starts affecting your daily routine, your daily life, then we have to think in terms of knee replacement. We must understand that all pain in legs is not because of knee. There are two types of pain in leg that we get. One that comes from spine, that is known as lumbar radiculopathy. What it means is that nerves from the spine, they come down to thighs and legs, and a person with spine problem may have pain in thighs and legs, and some people may think it as a knee pain, but that is not knee pain. We treat these kinds of pain with medications, and most of them do well with medications. Now, the problem with knee osteoarthritis is knee pain to start with. Along with that, there is bending at knees. What it means, the legs which are supposed to be straight like this, they start bending like this. So, once the bending starts, there is a mechanical problem, and that mechanical problem is of instability. There is instability, there is insecurity. So, there is risk of fall, there is waggling gait because of that bending of knees. So, knee osteoarthritis, knee arthritis is more of a physical mechanical problem, and once bending starts, unfortunately it is progressive in nature. So, once bending starts, we have to think in terms of knee arthroplasty. So, knee arthroplasty is the technical term of knee replacement, which is also known as knee resurfacing. Now, knee resurfacing, knee replacement, knee arthroplasty, they are all synonymous. So, to start with, in knee arthritis that we get in several cases, in most of the cases, is either mechanical wear and tear, which is known as osteoarthritis, which is akin to wear and tear of the car tires, and several times we get inflammatory arthritis. It can be rheumatoid arthritis, it can be juvenile rheumatoid arthritis rarely. So, juvenile rheumatoid arthritis is arthritis which starts at a very young age, let us say 12 years, 15 years it starts. So, we get this kind of arthritis, and once the bending starts, we think in terms of knee replacement. Now, this bending, if it is in earlier stage, then we may get away with partial knee replacement, which is known as unicondylar knee replacement. Now, unicondylar knee replacement is not half knee replacement, it is not half knee replacement, it is a different concept wherein only the diseased part is replaced by another implant and the ligaments are left. For example, this is our knee joint, this is our knee joint. So, it has got the cartilage, and there are ligaments which are known as cruciate ligaments, and there are collateral ligaments. Several times, so there is selective wear and tear only of the one part has worn out. So, in this case we replace only this part and the ligaments are left intact, and that is known as partial knee replacement, also known as unicondylar knee replacement or unicondylar knee arthroplasty. Now, it can only, the good thing about partial knee replacement or unicondylar knee replacement is that the natural anatomy of the knee is it is more knee preserving surgery. Natural anatomy is nearly preserved and the feeling is natural. The recovery is really fast, but what matters is the end result, and in partial knee replacement cannot be done in every case. So, that is a issue. that partial knee replacement cannot be done in every case, and we have to choose on case to case basis. So, in knee resurfacing, knee replacement, basically we resurface the surface. So, this is the knee joint in which the parts are diseased, and this worn and torn part, wear and tear, is replaced by a new surface which is known as knee resurfacing or knee replacement. So, this is a new surface which has been put in, and this is knee resurfacing or knee replacement. Along with this, there is realignment. The bent knees are again realigned like this. So, knee replacement is knee resurfacing and realignment of the knees. Now, we get several questions like, what is the right time to do knee replacement? Well, the right time is when you need it. There is nothing called we have to wait for that age, because the life is precious now, and if you need it now, it has to be done. And then there is a question that what will happen after 15, 20 years or 25 years. So, every knee has got a lifespan, and the knee replacement has also got a lifespan of 20 years on average, and it can be redone. It can always be redone. It can always be revised, which is known as revision knee replacement. So, it can be done second time also, it can be done third time also. So, that is known as revision and re-revision knee replacement. So, there is no age bar of knee replacement. Whenever it is needed, it should be done, because the goal of knee replacement is to promote painless and stable movement, and to bring back the quality of life by restoring painless and stable movement. We get many times we get queries whether it is better to do one knee at a time or both knees at a time. Well, both ways is equally good. If we do both knees at a time, we are more meticulous in our work, we monitor more closely the parameters after surgery like hemoglobin, sodium, potassium and all those things. But a benefit of doing both knees in single sitting is that the recovery is simultaneous, and the limb alignment restoration is simultaneous. So, that is the benefit, but very well we can do one knee at a time also, because worldwide one knee at a time is done more, and it is also equally good. After several months, some months, few months, you can do the other knee also. Well, many people think that knee replacement is about getting the best implant. Is there a best implant? Probably no. There is nothing called best implant in knee replacement, because it is all about mechanics, it is all about precision, it is all about the surgical expertise. There is nothing called best implant. Multiple companies are there, multiple designs are there. For example, we presently use a mobile bearing knee, which is also known as LCS knee. So, this is one of the most advanced implants. This is one of the most advanced implants, mobile bearing or LCS knee. But there is nothing called best implant. We also use something called medial pivot knee, which is supposed to be more natural knee, medial pivot knee. So, we have multiple designs like fixed bearing knee, mobile bearing knee, medial pivot knee. We have multiple alloys which are used like cobalt, chromium, titanium, niobium. But the question is, do these matter? Probably no, because whatever you do, the results are dependent only on surgical precision, because it is mechanics, it is physics, it is mathematics. So, the surgical precision and expertise will give you results. Now, when you are preparing for knee replacement, you need to do muscle strengthening exercises. Those muscle strengthening exercises are very important, because if you have started doing exercises before surgery, you are likely to recover faster after surgery. Muscle strengthening exercises are important. Along with this, if you have nerve pain and all, it should also be simultaneously treated along with knee replacement, because once you start walking, nerve pain may come back, and that also needs to be treated. Now, there are multiple developments like robotic knee replacement, navigated knee replacement. I had been using navigated knee replacement since 2012, and we are presently using robotic knee replacement. Well, robotic knee replacement is still, it is done by surgeon. Robotic arm is just an instrument to facilitate the measurements, the precision, etc., and still it is being done by surgeon. But the results of knee replacement are really multifactorial. There is the patient's exercises which do matter, and own motivation and positive approach is very important to get good results. We continuously do our work and follow up the results. For good pain control, we use nerve blocks both before and after surgery, and we do use multimodal analgesia approach. We provide physiotherapy at home. Presently, we are also doing stitchless surgery in which no stitch cutting is needed for our outstation, especially for our outstation patients. And if stitch cutting is needed, it can be done at home. Physiotherapy is done at home, and we give the guidelines, the videos, etc. for physiotherapy, and we make sure that your whole experience is extremely smooth and painless, and recovery is accelerated by various rehabilitation means. So you are most welcome to come to us in Kolkata. In case any of your friends, relatives, or any of us do need a knee replacement surgery, you are welcome to come to us in Kolkata.